All right, so we're going to get started. Today we're doing a demo of the SDOH closed loop referral system. So just a few housekeeping items before we get started. You've probably noticed that you're on mute as you've entered the room. We're going to keep everyone on mute throughout the presentation. If you have any questions at any point in time, please enter them into the chat. We're going to have someone monitoring the chat. They'll grab the questions, and as you see on our agenda, we'll answer those towards the end. So I'm going to do a brief few-minute introduction, and then we're going to jump right into a system demo for about 30 minutes, and then we'll have a Q&A for the remainder of the time. So I'm going to start off just talking about our program partnerships. So Health Current has teamed up with Access along with 211 Arizona, which is operated by Solari Crisis and Human Services, and NowPow. We've come together to build a statewide social determinants of health referral system for Arizona, and we thank you all for attending today to learn more about this amazing collaboration. And in addition to our key partnerships, we've had over 30 organizations participate in our social determinants of health work group, and this group really helped in the identification of the different features that are in the system. And we really want to emphasize that this will be a statewide solution for all Arizonans, so you do not need to be enrolled with Access to use the system. A member does not need to have access to use the system, and as an organization, you do not need to be an Access provider to use this system. It will be free for all Arizonans and for all healthcare and community-based organizations to use for making referrals for all of their clients. In the program Genesis, so this is part of Access's Whole Person Care initiative, which Access officially launched back in November of 2019. And the Access Whole Person Care initiative focuses on the critical importance of addressing social risk factors as a key part of a person's health and well-being. So Access connected with community stakeholders and identified 3 key areas of need: transitional housing, non-medical transportation, and long-term care, and social isolation for people in long-term care services. And so the system that you're going to see today is a referral system that is aimed at addressing those social determinant of health risk factors. And we are going to jump right into that demo. So I'm going to pass it over to Natalie. Natalie Hammond-Paul from NowPow to do the presentation.
Thank you, Andrew. Hi, everyone. I'm Natalie. I'm going to take you on a brief tour of the NowPow platform. Can everyone see my screen okay? Okay. So for the purposes of this demo, I've logged into the browser version of the platform. The platform is optimized for mobile devices and tablets. This is useful if you have community health workers, peer support specialists, or even care coordinators who are mobile and out working with patients. On the landing page, I can see the clients that I've recently interacted with. I can tell from this bell icon that I have a new message from this patient. And I can also see over here that in the notifications tab that I have some new messages here. The tab that says clients can be changed to say patients, participants, members, or even student for an education-based organization. The right side of the page displays recently added services to the community resource directory. The service directory is maintained by NowPow's in-house community resource team in partnership with Arizona 211. So I'm going to jump right into the services page. You can see right here that I have favorited some organizations that I frequently share with patients. You can tell they're my favorite by the orange star icon. The pink ribbon indicates that this is a preferred organization, and the green linked icon indicates that this is a closed loop referral icon. I can also request a service using this button. If I notice that there's a service that's not in the resource directory, I can add information about that service here, and this will be sent to the community resource team to call that organization and get them added to the resource directory. There are a couple of different ways to search for services and organizations using the resource directory. The first is by using the smart search bar. If you type in the name of a service or an organization, it'll show you different services and organizations within the geography that's indicated here. This can also be filtered to be a shorter or a larger search radius. You can also use the service categories to look for a new service. NowPow has 20 different service categories that break out into over 200 different service types. This might be useful if you have a patient on the phone, or if you're at the registration desk and a patient's expressing the need to find some food. You can quickly search for some food pantries here. I can see that there's a list of resources. There are 227 different resources for food pantries here. What I can do is I can shorten the search radius to 5 miles. And I can also use NowPow's filters. These help if you're looking for something specific, including fees, if you're looking for a free service, if you're looking for a service that accepts insurance, if your patient speaks a language and you want to make sure that that service can service your patient. And you can also search for services that are open on the evenings or the weekends. So my patient works during the week, so I'm going to look for a food pantry that's open during the weekends. You can also see that we have COVID-19 status filters. Since the pandemic, some organizations have changed their operations to delivery or pickup or phone or virtual services. So we can look for those specific services here. I'm going to apply this filter to find a food pantry that's open on the weekends. At a glance, you can see basic information about each organization, including their address, the languages that they serve, any fees associated, and the hours of operation. Once we click into an organization's profile, you can see some basic information about the organization, including their hours of operation, any fees associated, and the languages that they speak. Each different service or program that this organization offers has its own service card. And on each service card, you'll see some information about that service, including the hours of operation for the food pantry, which may be different than the hours of operation for the general organization. The contact information for that particular service, any intake processes, we can see that walk-ins are accepted, the service, and that the service is free. As you can imagine, this information is not available through web searching. A third of NowPow is dedicated to building and maintaining this resource directory by calling the service suppliers and confirming this service level detail on a regular basis. The resource directory is maintained in collaboration with Arizona 211 on an ongoing basis to be able to provide you with a robust resource directory that can be used by everyone. The recent date of verification is here. Once you decide that this is in fact a service that you'd like to share with your patient, you can share it in 3 different ways. You can print this entire page, and before you do so, you have the option of translating it into over 100 different languages. So you can print this page using the print button, and you can also nudge it. Nudge is NowPow's word for share. So you can share this page via text or email with your patient. You can type in the patient's phone number or search for their name, or you can customize this message. The important part of this message here is this hyperlink, which will send your patient directly to the patient-facing version of this organization's profile. You also have the option to include a V-card in this message, which makes it easy for your patient to save this organization's contact info right into their contact list in their phones so that they don't have to sift through text messages to find it again. We can send this text message and share this info with our patient here. In addition to this ad hoc workflow to find a service, we can also support a patient or client specific workflow. You can search for your clients. You can search for your client by looking at by typing in their name or their ID. And there are a couple different ways to get your patients loaded into the system. They can either be added to the system through a client panel upload if you have a special or high-risk population, such as a diabetes registry. So you can work with HealthCurrent to get all of those patients uploaded into the system. And you can also create new patient profiles on the fly by clicking this Create New Patient button right here and entering some basic information. The NowPow and HealthCurrent technical teams are currently working on building an HIE integration to be able to pull down demographic and condition information right from the HIE into the NowPow system. NowPow can also integrate directly with your EMR. So it's important to include the patient's basic demographic information. So we're going to walk through what this patient profile creation looks like. It's important to include some of this demographic information so that the system can match resources based on this specific information. So whether an organization has age restrictions or geographic restrictions, we want to be able to focus our efforts on making sure that referral is right for that patient. There's the option to add the address information as well as any emergency contact information. And again, all of this info can be pre-uploaded in a patient panel as well. So we're just adding in the address here. My mouse is being a little funny. Okay. We can add additional demographic information. There's space to include insurance information, as well as different members of the care team, including the PCP and their contact information. We can add information about other assessments that may have been conducted outside of NowPow, as well as specific condition information. So we know that our patient Elaine has type 2 diabetes. So we're going to add type 2 diabetes into her profile. This will help us to find services that support individuals with diabetes. There's also a space to add any self-management goals that you're working with your patient. So now that we've created the patient profile, we can see all the information we just entered on the right-hand side of the screen. We have the option to manage contact consent right within this platform. The client engagement timeline allows you to see all of the previous interactions that you've had with this patient, whether it's a screening you conducted in the system, a text message exchange, or a closed loop referral that you've sent for this patient. I'm going to show you the screenings tab so we can identify Elaine's needs and then find resources to fit her needs. Now PAL supports a variety of different screenings. We're going to go through the prepare screening today, but know that we can add any custom screenings and that these screenings can be translated into different languages to best support your patient population. You can see that Elaine's address was pulled in here to be able to find resources right in her area. Elaine needs support with food, clothing, and childcare, so we're going to indicate those needs here. And we have the option to add additional questions for different staff members at your organization. Once the screening is complete, we can see the 3 different needs that were identified for Elaine. We have the option to edit the screening at this time because we know that sometimes additional things come up in conversation, and we want to make sure we can capture those needs if they come up. Once we save the screening, we can add any notes, and it'll be saved to that client's profile page. Now I'm going to generate a health ERX. An ERX is a list of resources for your patient that encompass multiple needs. We can see, in accordance with the needs identified for Elaine, we have services here to support financial stability, food and nutrition, clothing, and utilities. We can make a referral to an organization right in this system. You can see here that we can easily make this referral and open up the referral form. This referral form, which supports the closed loop referral process, pulls in Elaine's information, including her contact information, and we have some information about the referral partner. We have a reminder here that walk-ins are accepted, but appointments are preferred. And we know that we can remind Elaine to bring her proof of ID and residence. We also have the option to upload any documents to this referral form, and these documents can also be saved in Elaine's profile. The service provider has the option of adding any additional questions to this referral form to ensure that it's a successful referral. We can add any additional notes. Elaine works during the week, so we're going to let the referral provider know that Elaine is best reached after 5 p.m. so they have a good chance of getting in touch with her. As we come down here, we get verbal consent from Elaine that she has acknowledged that we're sending this information over to the service provider and making sure that she's okay with that. We also have the option to flag this referral as urgent. We're going to go ahead and send that referral. And now we can save this list of resources to Elaine's profile. We now have the option again to share this entire list of resources via download to print or nudge through text message or email. I know that some folks on the line may be doing social determinants of health screenings in their home EMRs. So if that's the case, I'm going to show you a couple of different workflows to provide Elaine with those resources if you conduct those screenings in your EMR. So there are a couple of ways we can do this. We can build a list of resources, a Health ERX, by using this feature here. You'll notice the Health ERX page brings in Elaine's address so we can find services in her area. We can look for services by category. So we know that she needs support with childcare and food and housing. So we can select those services. These services mirror those that I showed earlier in the resource directory. At the bottom of this page, you can see the resources that I selected, and you can choose to add or remove these resources at any time. We again have the option to add any filters depending on Elaine's needs and situation, and we can generate that Healthy RX, that list of resources. Once we're on this list of resources, we have the option to further tailor this. We can choose to remove any resources, we can add comments, and we can also view alternatives and add any additional resources from the resource directory or from our favorites list. Another way to create a list of healthy resources for your patient is to use our custom conditions algorithm. These algorithms pull resources that support individuals with different health and social conditions. So we know that Elaine has diabetes and that she has children and needs support with food. So we can create a list of resources that help her meet those needs specifically. We can again send a referral right from this page. And I'm going to show you one more way to send a quick closed loop referral for Elaine. When we click on this referral sub-tab in the patient's profile, we can see all of the referrals that have been sent for Elaine. This is a good place to follow up on any referrals that may not have been accepted yet. We can also choose to send a message to the service provider to ask them if they've been able to contact Elaine and what's been happening with that referral. I'm going to add a quick referral for Elaine right here. I can easily see a list of all of the partners in my area that can receive closed loop referrals. And I can also look for these referrals through my favorites. So we can send a referral for Elaine here, get her verbal consent, and there it goes. We can also look at the referrals tab in the navigation bar to be able to look at any referrals that I've sent for any patients that I've been working with. This is a good place to come first thing in the morning or at the end of the day if I'm a case manager and I want to follow up on any referrals that I've sent to make sure that the patients I'm working with are getting the services that they need. So I can take a look at all these referrals either by service type or by specific client. I can see the referrals that I've sent, and I can also look at referrals that have been sent by my team or my department in those situations where we need to cross cover for one another. I can filter by referrals that are open, in progress, or new. And I can see here a little bit more information about that referral, including this patient's information, who sent the referral receiver, and any referral notes. And again, I can send a direct bidirectional message right to the referral receiver in this platform. This eliminates the need to play phone tag or send multiple emails to the service provider. I'm now going to show what it looks like from the service provider side of the system. I can see all the referrals that I've received now. Again, I can look by client or by specific service. I also can look through overview or a specific task view. This allows me to see how patients move through a referral, and this is especially useful if your organization creates appointments for clients that they work with. So I can see that I have a new referral for Elaine. I can go ahead and accept this referral. I can also choose to deny or waitlist. And I can say that we've contacted Elaine and that we've scheduled her an appointment for Monday. I can also add any additional notes here. Once I save this appointment, I can see that it moves from new referrals to upcoming appointments. And here I can send a reminder to Elaine that she has an upcoming appointment. The appointment reminder template includes the day and time of the appointment, the address, any documents that are required, and the phone number. I can also choose to customize this message. I can also send batch appointment reminders, which is really convenient if you have a long list of upcoming appointments. Once the appointment date has passed, it moves into the attendance and outcomes section. I now can share more information about what happened with this appointment. This patient showed up to the appointment and the service was received and the outcome was successful. Service providers have the option of customizing a service outcome detail section where we can say a little bit more information about what happened with that service. Why was it successful? I can add any additional notes here, and then I can close out this referral. For patients that I've waitlisted, at any moment, I can come in and move them off the wait list or deny an appointment. I'd like to show a dashboard where service providers can see a breakdown of all of the clients they've worked with, if appointments were scheduled, if referrals were accepted, what the no-show rate is, and what the most commonly referred to services are. This information can be incredibly useful in reporting and writing grant proposals. Now, we're now going to take a look at the Analytics tab. In our Analytics portal, we have 15 different live on-demand reports at 4 different levels, from the ecosystem level to the organization level. And you can download these reports in a variety of different formats. We're going to look at the match report. We can choose any date range we'd like, and we can choose to look at the entire enterprise. This report is going to show us the top service provider organizations, who are the organizations that we're sharing information the most, and what are the most common service types. This gives us some more insight into what the most prevalent patient needs are in my patient population. This report also shows the average distance our patients are traveling to services. So we're able to see if our neighborhood has the resources it needs to meet the needs of our patient population. And with that, I'm going to turn it back to Andrew to talk about next steps in the process.
Thank you, Natalie. So I'm going to put the PowerPoint back up here. anyone has any questions, now's a good time to enter them in the chat. We're going to cover the timeline here real quickly, and then we're going to get to the question and answer part of the session. So for the timeline, right now we're still in the implementation and planning stage, and we'll be starting the early adopter pilot phase over the summer, where we have a few small groups that we're doing some limited use cases over the summer. And then this will be live for everyone in the fall of 2021. We just want to highlight that getting signed up for the system will be easy. There will be a user agreement that you'll need to complete and sign. Then we'll identify the staff that'll be accessing the system, and there's no limitation as to the number of staff you can have using the system. And then we'll provide user training, live user training for your staff, as well as there's an option for a train the trainer so that you can have internal resources as your trainer. And I want to highlight that HealthCurrent and NowPal will be with you throughout the entire process. So training and support will not end with a sign up, and we'll be there to support you with any additional training or support needs as we go along. Many of you have probably already done this, but just wanted to point to the healthcurrent.org/SDOH website. You can get additional information about the system there, as well as complete an interest form. And the interest form is really the first step to letting us know that you're wanting to connect to the system, and we'll keep you connected for any updates as the program progresses. And here's my contact information, as well as our manager, Clay Cummings' contact information. If you have any questions about the system, feel free to email us, and we'll get back to you as quickly as we can. We're going to now shift into the question and answer part. Clay, do you want to read the questions we have so far?
Sure. Thank you, Andrew. We have 3 questions that are integration related. I'll ask the middle one. So, our providers prefer to stay within their EMR. What integration options or SSO or other means does NowPal offer?
Great question. So I'm going to answer very high level, and then I'll pass it to NowPal to maybe speak to a little bit more of the detail. So this is an internet-based system or cloud-based system. So you can access it by entering the website as you saw in the demo today. However, this will also have the option to integrate with your EMR, so they can be a single sign-on integration as well as a bi-directional integration. So in that workflow, if you're doing a screening in your EMR, there is the option to integrate that screening into the platform so that you're entering that data in your EMR, and then that data is getting sent over to the referral system. And now I'll kind of pass to NowPal to talk more about the details of how some of those integrations work.
Thanks, Andrew. Yes, absolutely. So NowPal has experience integrating with multiple different EMR platforms and case management systems using APIs, FHIR, and HL7. And some of the EMRs that we've integrated with include Epic, Centricity, Cerner, and Athena. And we can work with both HealthCurrent and your technical teams to figure out an integration that could best support your workflow. Integrations can include functionality, including single sign-on, passing through demographic information, and sending documents from NowPal back to your EMR, including that screening data, the closed loop referral information, and those HealthyRx documents.
Thank you, Natalie.
Thank you. Are there particular criteria for a successful referral? I know you can add notes to elaborate, but wondering how that info gets pulled into a report, or how one might interpret the blanket successful referral data point in a report.
So the closed loop referral feedback can be set up to mirror your workflow. So you can set up the different points that Natalie showed to produce the information that you want to receive from that referring partner. So you don't need to have every single one of those steps, or you can have all of those steps. And then we can work to customize what those steps look like. And it does produce a document that can be tracked or can be pulled into your record. And Natalie, anything else on that?
Yeah, I would say that defining a successful referral really is part of that conversation between the service requester and service provider, and getting on the same page about what a successful referral looks like. And then of course, taking advantage of the ability to determine those, the outcome service level details, and providing updates within the system. But we really encourage the electronic communication process to mirror existing partnerships and what it would look like if it were to be done over the phone or via email.
Thank you, Natalie. Will all community agencies have access to NowPow to respond to referrals, or is it up to the healthcare organization utilizing NowPow to set up their own small networks for referrals?
So it will be up to organizations to set up networks, but in that 211 Arizona partnership, we'll be bringing on their full database. So you'll have access to the community-based organizations and other providers on the system. But if you want to have a closed loop relationship with an organization, that you'll need to establish in that relationship with them. So those services will be available to send referrals or send those shared referrals, meaning you're sending the client a copy of sending them that push notification saying, here's where you can go to get the service. But unless you set up that relationship with the community-based organization or other provider, that closed loop won't exist unless you've established that with the other organization. So it's that you are creating that network for the closed loop.
Thank you, Andrew. Are there detailed spec sheets for integrations like a Cerner integration?
I'll pass that to NowPow.
Yeah, we're happy to follow up and have provide some more information about integrations with specific EMR. So here's exactly Andrew and Clay's contact info, and we can get that over to you.
Thanks, Natalie. Here's another question from Dan. I heard SSO, good, but not an API, and HL7 EMR integration. Any REST APIs?
I'm going to turn that to NowPow. I'm not sure on those details.
We currently have an API with Epic, and again, we can, our technical team can provide some additional follow-up on more specifics about REST API.
Thanks, Natalie. Is it the responsibility of the practice to establish their own network?
So as I said before, there will be that 211 database. So you'll have all of those referrals, or all of those service providers will be on the platform. But as far as setting up the closed loop relationship, that will be the providers and community-based organizations determining what those relationships look like. So yes, it would be looking at who your key partners are right now and what types of, looking at the organizations that you're making a lot of referrals to and you're working very closely with, and just using this system as a means of being the way of communicating. So if you're doing emails, phone calls, faxes, now you can centralize all of that communication and all of that passing of information for referrals onto this system. So yes, you'll have to build your own in that sense, but we're going to work on HealthCurrent, and NowPow will be there to help with all the technical pieces and getting everything set up. But you'll need to identify who those partners are.
Thank you, Andrew. Can we incorporate our own internal assessment tool?
Yes, so there is an option to build a custom screening tool or take a screening tool that's in the system and modify it to best suit your needs. But so both are an opportunity. And if you have a custom tool in your system, we can build that into the NowPow system or integrate that with the system.
Thank you. This is going back to the network building. Will that require an extra agreement when we build these networks?
It will not require any extra agreements with HealthCurrent. So the system those organizations should be on the system as a shared referral provider, and we would just create that closed loop relationship on the technical side, but there will not be an additional agreement that you need to sign from the HealthCurrent or NowPow perspective. If there's an agreement that you have with that organization, that would be a separate process.
I wanted to add one
Thank
more
you.
note about closed loop referral partners. We have access to data, as I showed in the analytics, about which organizations are being referred to most frequently. And in our partnership with Arizona 211, we're able to see the different organizations and their service types in specific geographies. So we can use that data along with our community engagement team to really reach out to those community-based organizations and invite them to be part of the closed loop referral program.
Thank you, Natalie. When a new provider is added to the directory, do they have to pay for access as an accepting provider for referrals, or do they get a free login to accept referrals?
So at no point in time in the system is there any cost. So the use of this system will not cost anyone, regardless of whether you're an access provider, healthcare provider, CBO. The system is completely free. There's no cost that will come from HealthCurrent or NowPow regarding integration or regarding building custom screening tools. There will be no fees, no costs associated with this whatsoever coming from HealthCurrent or NowPow.
Thank you, Andrew. And that's all the questions we have at this time.
Well, with that, thank you everyone for joining us today. Thank you for all the great questions, and we hope you have a great day and a great weekend.